Welcome back to peer-guided DBT lessons provided by DBT skills application, Peers Helping Peers. This week's lesson, marked 3-16 in our emotion regulation module, will be looking at please skills. And we ask that you please keep in mind that we're simply peers helping peers working together to bring about more peaceful, constructive, and ultimately happier lives. In other words, a life worth living. So what does the please stand for when we look at please skills? Well, first we have P for physical health, L for lather and rinse, E for eat balanced, A for avoid mind-altering agents, S for sleep balanced, and E for exercise. Let's start with P for physical health. These skills are so very important because if we neglect our physical health, we open ourselves up to being very vulnerable emotionally. Be sure to make your physical well-being a priority. Make sure that you are taking any medication that has been prescribed to you by your physician and that you're getting your routine checkups. Also, when you feel ill, it is extremely important to make an appointment to see your doctor because you want to return to optimal health as quickly as possible. Remember, when you are feeling well, you're less likely to spiral out of emotional control. Most people are aware of some physical conditions that cause as many emotional symptoms as symptoms affecting the body. Let's look at a couple. PMS, for example, which is a hormone-related disorder. Researchers think that PMS happens in the days after ovulation because estrogen and progesterone levels begin falling dramatically. PMS symptoms go away within a few days after a woman's period starts as hormone levels begin rising again. Some emotional or mental symptoms of PMS include irritability or hostile behavior, feeling tired, sleep problems, sleeping too much or too little, appetite changes or food cravings, trouble with concentration or memory, tension or anxiety, depression, feelings of sadness or crying spells, and mood swings. Then we have diabetes, which is metabolic related. Metabolism is the chemical process your body uses to transform the food you eat into the fuel that keeps you alive. A metabolic disorder occurs when the metabolism process fails and causes the body to have either too much or too little of the essential substances needed to stay healthy. Our bodies are very sensitive to errors in metabolism. The body must have amino acids and many types of proteins to perform all of its functions. For example, the brain needs calcium, potassium, and sodium to generate electrical impulses, and lipids, which are fats and oils, to maintain a healthy nervous system. Blood sugar swings in diabetes can cause rapid changes in a person's mood, such as making them sad and irritable. This is especially true during hypoglycemic episodes, where blood sugar levels dip lower than 70 milligrams per deciliter. Some low blood sugar symptoms might be feeling confused, feeling anxious, and having difficulty making decisions, whereas high blood sugar symptoms might include difficulty thinking clearly and quickly, feeling nervous, or feeling tired, or having low energy. Next we have flu and cold, which triggers an immune response. Our immune, neurologic, and psychological systems are closely intertwined. When there is a foreign invader in your body, like the influenza virus, your cells produce pro-inflammatory cytokines, non-antibody proteins that activate and organize your body's immune response. These chemical proteins circulate throughout your body and communicate with your brain, which in turn produces its own cytokines. These brain cytokines lead to fever, fatigue, depressed mood, lack of appetite, lack of motivation, social withdrawal, poor concentration, and altered sleeping patterns. In other words, the physical sickness caused by the inflammatory response significantly overlaps with depressive symptoms. Illnesses like the flu or the common cold can closely mimic and cause depressive symptoms by activating your immune response and inflammation in your body. Our next letter is L for lather and rinse. Poor personal hygiene is seen as unacceptable and unhealthy in most cultures. People do not want to be around someone who has bad body odor or if they are not clean. An individual's body naturally harbors bacteria. However, if the bacteria are allowed to build up, then they become harmful to the individual and others. The buildup of bacteria begins to smell. We call this body odor. It is vital that an individual keeps their body clean and free from infection on a daily basis. Depression is one of the indirect consequences of poor personal hygiene. It begins from a common feeling of low self-esteem plus low self-worth brought about by poor hygiene. The affected person does not feel good about themselves. When you live with depression, often everyday tasks like maintaining personal hygiene can feel at best difficult and at worst exhausting. When you're struggling to get out of bed and fighting the ruminating thoughts characteristic of depression, showering and brushing your teeth may be the last things on your mind. Here's some tips and tricks many people with depression use to take care of their personal hygiene. Number 1. Using dry shampoo. 2. Sponge bathing. 3. Setting personal hygiene alarms. 4. Using baby wipes. 5. Using mouthwash when you can't brush your teeth. 6. Tricking yourself into showering. 7. Using a shower seat. And 8. Asking for help. For more tips, see the lesson handout. By being well presented, clean and tidy, people can feel more confident, especially in social situations. Our chances of succeeding either in work or social settings or even with the opposite sex can be altered by maintenance of good hygiene. Our next letter is E for eat balanced. What's for dinner? The question is popping up in an unexpected place, the psychiatrist's office. More research is finding that a nutritious diet isn't just good for the body, it's great for the brain too. The knowledge is giving rise to a concept called nutritional or food psychiatry. To keep your body healthy, for all of us, eating right can help you maintain a healthy weight and avoid certain health problems, but your diet can also have a profound effect on your mood and sense of well-being. Studies have linked eating a typical Western diet filled with processed meats, packaged meals, takeout food, and sugary snacks with higher rates of depression, stress, bipolar disorder, and anxiety. Eating an unhealthy diet may even play a role in the development of mental health disorders such as ADHD, Alzheimer's disease, and schizophrenia, or in the increased risk of suicide in young people. Have you heard the term nutrient density? This refers to foods that are rich in one or more nutrients per calorie. Foods that are naturally rich in color are often considered nutrient dense. We all know that we should eat more fruits and vegetables, but how colorful is your plate? The brightest and most colorful choices are some of the healthiest. They usually contain the most antioxidants and are rich in vitamins and minerals that help your body function properly. Use the principles of colorful plate nutrition to get the most from your meals. Experts caution that while diet can be part of a treatment plan, it shouldn't be considered a substitute for medication and other treatments. Our next letter is A for avoid mind-altering agents. Many people who read this will simply reply, "I don't drink or use drugs, so I've got no issue with this one." That might not be the case because this is not as clear-cut as it seems. Number one, to start with, what if the mind-altering agent was prescribed by your doctor and the altered state is simply a side effect of the medication? It may be just a temporary side effect that will resolve during the course of treatment. If it is a medication needed for your condition, this temporary effect may be worth the expected benefits. It may be that the condition your prescribed medication is being used for is serious enough that the benefits of the medication outweigh the disadvantage of the side effects. Caution: remember, if a medication is prescribed for by a doctor, you should never discontinue it without medical approval. If it is agreed that the side effects warrant the discontinuation or decrease of a prescribed medication, this should only be done under medical supervision. Medications require different schedules for dosage decreases. Number two, let's look at the question related to drugs and alcohol. Are there ever cases that these substances may be more beneficial to use than the need to totally avoid due to mind-altering effects? Let's start with alcohol. The benefits: moderate, regular drinking, generally no more than 1 drink a day for women and 2 drinks a day for men, raises HDL, or the good cholesterol, and cuts the risk of death from heart disease by about 25%. It may also help prevent type 2 diabetes and ischemic strokes, the kind caused by blood clots. While moderate alcohol use may offer some health benefits, heavy drinking, including binge drinking, has no health benefits. Excessive drinking can increase your risk of serious health problems. It should be noted that alcohol consumption and its benefits vary based on an individual's body makeup and type. It is suggested that you discuss with your doctor the question of benefit versus risk factors in your specific case. Please note, alcohol use in order to bring about the mind-altering effects it can cause is never recommended. The question concerning the use of marijuana for the benefits that it can offer is mostly a question of classification. Is it a drug or is it a medication? That debate seems endless. The history of marijuana use for medicinal purposes extends back through millennia. The medical use of marijuana can be traced back to the year 2737 BC. In Western medicine, between 1840 and 1900, more than 100 articles citing marijuana's therapeutic qualities were published in American and European medical journals. In 1851, the United States Pharmacopoeia included hemp in its catalog of medicines. Marijuana was routinely prescribed by American physicians and enjoyed legal status in the United States until 1937, when U.S. legislature passed the first federal law against marijuana. With regard to documenting the effectiveness of medical marijuana, the most comprehensive analysis to date in medical literature was issued on March 17, 1999, by a White House commissioned committee of 11 independent scientists appointed by the Institute of Medicine. This government-sponsored study presented solid scientific data that indicates the potential therapeutic value of marijuana in controlling some forms of pain, alleviating nausea and vomiting, treating wasting due to AIDS, and combating muscle spasms associated with multiple sclerosis, just to name a few. Note: if your physician deems in your specific case that the benefits outweigh the side effects and it is legal in your location, and it does not go against your personal values, it should fall under the same guidelines as other medications. What about your diet? If what you eat or drink is mind-altering, should those things be avoided too? Food additives and poor diet could help explain poor school performance, criminal behavior, alcoholism, and the growing numbers of Alzheimer's patients. According to Dr. Russell Blaylock, high sugar content and starchy carbohydrates lead to excessive insulin release, which in turn leads to falling blood sugar levels or hypoglycemia. Hypoglycemia causes the brain to secrete glutamate in levels that can cause agitation, depression, anger, anxiety, panic attacks, and an increase in suicidal risk. Behavior modification through diet. Avoid sugar and white grains, including fruit juices, breads, white rice, pasta, and potatoes. Avoid anything with high fructose corn syrup. Avoid all artificial sweeteners. Limit MSG intake by avoiding most processed foods. Avoid eating or drinking anything that you have experienced a mood change after consumption. Our next letter is S for sleep balanced. Sleep and mood are closely connected. First, let's take a look at what happens with too little sleep. Research studies in healthy people have shown that even one night without sleep causes sleepiness, fatigue, irritability, and lack of motivation. Sleep loss will make us feel more upset, angry, and sad in response to unpleasant events, and make us less able to enjoy and be happy about good things in our life. We also know sleeping for less than 5 hours per night for several nights in a row can have a significant effect on our mood. People become sadder, angrier, more stressed, and mentally exhausted if their sleep is restricted in this way. When they are then allowed to have a normal amount of sleep, they report dramatic improvements in mood as they recover from sleep loss. Now let's look at what happens with too much sleep. Sleeping too much could turn out to be just as damaging as sleeping too little. Depression and sleep go hand in hand, but it's a chicken and egg situation. Often people with certain types of depression sleep longer, and longer sleep can make depression worse. In some cases, shortening your snoozes might be enough to lift your spirits. And our last letter is E for exercise. If you've ever gone for a run after a stressful day, chances are you felt better afterward. The link between exercise and mood is pretty strong, according to Michael Otto, Ph.D., a professor of psychology at Boston University. He goes on to say, usually within 5 minutes after moderate exercise, you get a mood enhancement effect. But the effects of physical activity extend beyond the short term. Research shows that exercise can also help alleviate long-term depression. Some researchers suspect exercise alleviates chronic depression by increasing serotonin, the neurotransmitter targeted by antidepressants, or brain-derived neurotrophic factor, which supports the growth of neurons. Another theory suggests exercise helps by normalizing sleep, which is known to have protective effects on the brain. Some of the evidence for that comes from broad, population-based correlation studies. There's good epidemiological data to suggest that active people are less depressed than inactive people, and people who were active and stopped tend to be more depressed than those who maintain or initiate an exercise program, says James Blumenthal, Ph.D., a clinical psychologist at Duke University. So in recapping, caring for your physical health is caring for your mental health. So please, take care of your physical health. Take care of your physical hygiene. Eat nutritiously. Avoid mind-altering substances whenever possible. Sleep balanced and exercise. If you're feeling down, anxious, etc., check through the list above. Please make sure you are caring for your mind Expecting for your brain to run smoothly without giving it what it needs is like expecting your car to provide reliable transportation without gas, oil, or water. It is not possible. And please note, it is unwise to attempt to make life-changing decisions when your brain is being deprived of one of these needs. Next week in our peer-guided DBT lessons, emotion regulation module, we'll be looking at vitals and sweeten the pot.